So this is going to be going over a general rehab protocol for a hip arthroscopy. Generally, a patient shows up with crutches, non-weight bearing, and that usually lasts for 2 to 4 weeks, depending on the surgery. But regardless, the amount of weight bearing, the rehab usually goes the same. So usually when a patient first comes in, we'll say Emily had surgery on her left leg. We'll start with some gentle stretches. So the first thing that we would do would go over some internal and external rotation of the hip, but she's going to be maintaining all of her weight in the right leg. So she's just going to place that left leg on the stool, and she's going to take her leg take the foot as far in and as far out as she can, holding for about 5 seconds to get a good stretch on that hip. She'll do about 20 of these, holding for 5 seconds. So my instructions to her would be just as she's doing, take that leg in and hold, and now bring it out and hold just for a good stretch. So after that, we would then go next to the hip flexor stretch. So what she's going to do is she's going to bring that stool straight back, and she's going to be maintaining a good core contraction so she doesn't feel this stretch in her low back, and it's all coming from the front of that hip. So same thing, she would do about 20 of these, holding for about 5 seconds, and then back in. Do a few more of those. Okay. So the next thing we're going to work on is just some gentle strengthening around that hip for the first couple weeks. So I'm going to ask Emily to have a seat up here on the table. So we want to maintain good control of the quadricep, which is the large muscle here on the front of the leg. So what I'm going to do is place a towel underneath her knee here, and I'm just going to have her tighten this muscle up as she's pushing down into this towel, just like she's trying to push her leg backwards behind herself, but the table's going to stop her. She's just going to hold that for about 5 seconds, and then she's going to relax, and she'll do about 20 of those. We'll maintain doing these isometric contractions in the muscles for the first 2 to 3 weeks, and then we'll slowly progress into more strengthening. So after she's done about 20 of those, the next thing I'm going to have her do is working on the inside part of those that hip. She's just going to take a ball or a pillow. If she doesn't have a ball at home, she can take that, and she's just going to squeeze that ball, not full force, about 50%, and she's going to hold that contraction for about 5 seconds. Again, she's going to do about 20 of those. And that's good. Also in this, the first few weeks, we'll work on maintaining pain control, and with some of that, what we'll do is some soft tissue massage of the front of the leg around that hip, just to maintain any muscle tension that could be building up in there after the surgery. A lot of times after that, around the incision gets pretty sore and tight, so we'll do gentle massage around that hip.